As I told you in my introductory part, my research focused on understanding the factors that contribute to the spread of flu in a community, and I want to share some insights with you today. Influenza, commonly known as flu, is a viral infection that affects the respiratory system. It can be transmitted through air by droplets when an infected person coughs or sneezes or by touching the surface contaminated with the virus. This can be a serious illness. According to the CDC, during 2021-2022 flu season alone, there were 9 million flu cases recorded in USA, which is more than the population of New York City. There were 100,000 hospitalizations and 5,000 flu deaths, which equals to about 14 flu deaths per day. So this research aims to improve the community health by reducing the spread of influenza. How can we reduce the spread? Prevention and control are key measures here. Preventive measures like getting vaccinated and frequent hand washing, staying away from infected individuals will help to reduce spread by some extent. Another way to reduce spread is to break the chain of disease transmission. As we can see in the picture, one might get infected and spread it to other through various modes of transmission. It can be direct, indirect, or airborne. The key to reduce spread is to identify those factors that aid the spread of flu. To identify the events that contribute to the spread, we can start looking at interactions between infected persons and their contacts. So can you think of places where people interact with each other on a daily basis? Places like households, schools, workplaces. These are some commonly visited places where people interact with each other. Let us understand this better with this picture. Imagine a family of 4 living in a house where one person gets sick with the flu, and this person goes to college and exposes their classmates, who then spread it to their families and workplaces. So there are many different scenarios like this. So is there a system that records these interactions to help us understand how flu spreads? There is no single system that records all these kind of interactions. One way to do is to conduct surveys or interview the infected individuals about who they have been in contact for the past few days. This approach in some cases may not give us accurate data. Another possible way is to make use of electronic medical records. EMRs contain information about appointment visits, laboratory test results, which can be used to create a timeline of patient interactions. Additionally, EMRs also contain addresses and age information, which can be used to determine if a person is school-aged individual or not. We can connect people together by using EMRs, like by looking at patient visits to healthcare facilities where people go for routine medical checkups, vaccinations, and laboratory tests. Using this data, we can identify people who are exposed to an infected person on the same day and location of the visit as an infected patient. We can then assign different exposure levels to these people. Using addresses, we can connect the household members of these exposed individuals and assign the type of exposure, such as the household exposure. We can also identify the households of the infected individuals. Another way to look at the interaction is to look for school students and the household of those students. We don't have the information about schools related to patient. So we used age to estimate the school level the individual belongs to and use the address to mark the household of those students for possible exposures. So this is the architecture of my pipeline. All the required data was obtained in the form of CSV files from the EMR system, which were then cleaned and generated features like exposure levels, type of exposures, and school levels. This data was then fed into the machine learning algorithm called logistic regression, which acts as a binary classifier. The idea of using the machine learning is to predict if a person gets infected or not, given the features generated from EMRs. To get better accuracy of predictions, we can use deep learning algorithms like SVM, random forest, etc. This can make complex interactions of the provided features, but they do not provide us any information about how much a feature accounts for the impact on the outcome feature. Logistic regression provides us with that information in the coefficients. We can evaluate the model using the ROC curves, which can explain how good an algorithm is at distinguishing the infected and non-infected patients based on the connectivity features. If the chart right here in the corner, if this is perfect right angle, then the algorithm is able to distinguish perfectly between infected and non-infected individuals. This research was conducted in a secure environment where there is no access to internet to ensure the security and compliance with the patient health records. This bar chart indicates that my research population has similar distribution of males compared to the general population, with both representing around 60%. Additionally, for individuals below 19 years of age, my research population represents a very close match to the general population with 68.5% of males and 65.9% of females in my study group. This suggests that my research is a good representation of community. Results show that it is likely to not get infected if you have less exposures at healthcare or have less number of school-aged kids going to elementary school or not living in a household as an infected person. So this is just the first step of generating the connectivity of community using the features available within the EMR. In future, we can look at other interactions using the employer information or guarantor payer information within the same year that we have tested right now. Or we can look at different years with the same features we have generated. These are the next steps that can be done. This process strengthens the connectivity and helps in better understanding the spread of flu within the community. Also, EMR data only estimate the transmission based on the fields available and relatively complete within a healthcare setting and would not capture other settings such as the place of worship or entertainment venues or activities of daily life like shopping, something like that. Also, we may also miss those infected but who did not get tested. So these individuals would still represent an important transmission vector, but one that could not be captured via EMR. So what actions can we take based on this? As I mentioned earlier, the key to control the spread of flu is to break the chain of disease transmission. In order to facilitate that, we can make recommendations about healthcare level disinfection protocols or advise the school closures to reduce or minimize the spread to some extent. Or we can make informed decisions about mobile testing locations. In future, if some features of connectivity are generated that are significant, we can make use of more sophisticated deep learning models to make accurate predictions of risk of infection. This process that was developed to obtain connectivity can be utilized by other organizations that has similar EMR system to facilitate the community interactions among individuals that can help in analyzing the infectious diseases. Well, that's all from my side. If you have any questions, I would answer them to best of my knowledge. Thank you.